medical vision. Zebra is transforming patient care with AI. And the floor is yours. Please go.
Okay, is my screen visible? Am I audible?
Yes, you are.
Yes, yes.
So firstly, thanks to the organizers for this opportunity. A Zebra Medical Vision represents, I think, in many ways, the patterns and trends that a collaboration between India and Israel would look like in our own humble way. Given the current geopolitical landscape, I think India and Israel become natural partners. And I think events like this help give thrust to G2G going to B2B and people to people connect. I have the opportunity to serve Zebra for all emerging markets with India as a strategic focus. Generally, what I've seen is Israeli companies tend to focus primarily on US and EU in their initial life cycle, but I see that greater emphasis coming through towards India and emerging economies in their earlier cycles than has been previously. Over the next 10 minutes, I'll try and introduce the company and our technology as we attempt to transform healthcare, especially in radio diagnosis and radiology. If I'm unable to answer all questions on the chat or on the call, my email is on that screen and you could use that. So what do we do? Zebra is on a mission to transform patient care by teaching computers using deep learning algorithms to automatically read and diagnose medical imaging studies. So basically what we do is our AI solutions help radiologists by automatically and automating the interpretation of medical images for specific disease conditions. So we could read the images from a CT, from an X-ray, from a mammo, and the idea basically is we are not here to replace the radiologist, but we become an important complement. So my argument is that AI will not replace radiologists, but radiologists who start using AI will probably eventually replace radiologists who do not. To just give you an example of why AI is important, the challenge is that with the growth of medical imaging and scanning volumes, complexity has improved. A typical CT image spits out so much rich information that it is becoming humanly impossible to read these images without adequate support. So if you take an example of an average radiologist in a day reading about 50 CT studies, for example, each image, each study spits out between 400 to 1,000 images. So in an 8-hour shift of 28,800 seconds, you're talking about a situation where a radiologist today has less than a second to review an image. This is why AI becomes important. So I always give the example of looking at AI as an autopilot available to a pilot on a long transatlantic flight. You wouldn't want to use AI or the computer to do the takeoff, to do the navigating in a bad weather, or do the landing. But you're very happy, the pilot is very happy that there is a supporting AI and the computer that's available to him or her on a long journey. Three reasons why I think Zebra is at the forefront of AI in radiology. Reason number one, we've raised a bunch of money, is adequately capitalized, over 57 million from strategic investors. We have already received significant grant funding from the governments in India, in Israel, in the UK, and others. We have one of the largest pool of technology, AI technologists between Israel, US, and India. And also, AI is about data, right? So between Clalit, which is Israel's largest HMO and probably the world's second largest HMO after probably Kaiser Permanente, Intermountain, one of the better run institutes in the United States, and Apollo, and our own Apollo in India, we have a massive access to data, which we have carefully curated. The company is 6 years old, but we spent 2 years curating data and building a world-class data infrastructure, which we could use to deliver algorithms for various disease conditions. Zebra probably has the highest number of US FDA regulated algorithmic solutions amongst any player in the world today in the AI space in radiology. We have also been admitted into what is called the FDA's pre-certification program, alongside Apple computers, Google's Verily, etc., so that algorithms which will now come out of Zebra in the future would increase Zebra's ability to increase its distance and lead into the future. Several of our products are backed by solid science, and some of it has been featured in top deck journals like Nature and other peer-reviewed journals. Over 130 sites across the world, and a lot of uptake in India. And my personal view is that in the post-COVID world, one of the engines of economic recovery is going to be hospitals and healthcare systems, and this is going to be driven by population health. Okay, so what are our solutions? I would like to see our solutions in 3 buckets plus COVID. What are the 3 buckets? The first bucket is acute conditions triaging. So here we have algorithmic solutions to pick up intracranial hemorrhages, subtle bleeds in the brain, pneumothorax, and in the future we will extend this to LVOs, large vessel occlusions, stroke, pneumonia, and the holy grail of normal abnormal X-rays. In the screening triage, we have algorithmic solutions for pleural effusion, which can be a biomarker for other diseases, and also in mammo for breast cancer malignancy and suspiciousness of malignancy. Population health, which is a fascinating area, we have strong algorithms to pick up osteoporosis, bone disease, and cardiovascular. And towards the end, I will briefly talk about our COVID-19 solution. I just wanted to, on my screen, you see the 6 algorithms which are US FDA'd. We have the first on the left side, you see intracranial hemorrhage and pneumothorax, which is basically acute conditions, either in an emergency situation or in the ICU. You see screening with mammography and pleural effusion and population health in bone and in cardiovascular. So how does it work? A patient comes to a hospital, undergoes a scan, which is on the left side, a CT or an X-ray or a mammo or whatever. The studies get stored in the PACS, which is the storage in the PACS server. Zebra automatically writes a DICOM forwarding rule, and all the images get automatically transferred to Zebra's server, which could be on cloud or on premise, after they are anonymized. Zebra then provides insights, and all the insights are already inside the work list of the radiologist even before he or she opens the exam. Studies are deleted after the insights are provided, and the entire system is HIPAA, GDPR, and SOC 2 compliant to make sure we are sensitive to data privacy and other issues. As you can see on this slide, most of the radiologists, not just in India, but worldwide, work on a FIFO, on a first in, first out. So maybe there are patients deep down in the list who have a problem. So Zebra automatically picks up all these patients and then immediately puts to the top patients who have an abnormality. It could be bone, it could be brain, it could be lungs, it could be a heart. And when the radiologist goes to those abnormal conditions first, they are able to see the key image, which I'll show you in a moment. So let me show you what happens in bone. So this is osteoporosis, right? So here what happens is, take an example of a 60-year-old lady who goes to a hospital for a typical CT abdomen or a CT chest. What happens is the radiologist tends to focus on the abdomen. What Zebra's algorithm does is it automatically picks up a vertebral compression fracture on the spine, which is missed by radiologists 90% of the time. And what happens is we can then bring these patients back to the hospital and put them on a medication, thereby preventing a potential secondary fracture, which could be a hip fracture. 1 in 3 women who are postmenopausal are osteoporotic and are at serious risk of secondary fractures. And it is these algorithmic solutions that can actually help such patients and also reduce the cost to the government, such as the Ayushman Bharat scheme. I lost my father 2 years ago, within 2 years of a hip surgery. And when I did my research, I found that 40% of the people who undergo hip surgery tend to die within 2 years. And this is why the burden of osteoporosis is immense, and such value propositions are dramatic. So you can see here, Zebra, just from a CT abdomen or CT chest, has taken the coaxial images, reconstructed a sagittal, and has actually put a bounding box on where it has found the fractures. And you could bring up these patients. Similarly, we can pick up on a CT chest or a routine CT a cardiovascular scoring, known as the Agatston scoring, thereby picking up cardiovascular disease early. So as you can see here, this is a case study in Oxford where we've been able to increase the number of such incidents found from 200 to over 2,000, increasing it by 10x. So similarly, so what I just showed you was population health. Here is a brief on what we do in ICUs and in acute conditions where patients who have pneumothorax or other conditions that could potentially be fatal are picked up early. Imagine a situation late at night when you have junior residents in the hospital and you have situations like a subtle bleed. It always helps to have an AI that is actually providing you an extra level of safety and care. We've also seen in some of these case studies, which we conducted at Philadelphia and Einstein Medical, that we are able to reduce time to intervention by almost 85%. And this could be even higher if the images come directly from the modality instead of PACS. And before I conclude, I just wanted to take a minute or two to talk about our COVID solution. Most of the conversation around COVID has been around characterizing the virus, testing, tracing, tracking, and building immunity. But the problem is hospitals don't know which patient needs ICU, which patient needs a ventilator, what is the healthcare plan, because there is no way to scientifically characterize or scientifically quantify the burden of the disease. So you remember in Italy some time ago, frontline workers didn't know whom to give a ventilator. They just let people die thinking somebody is young and somebody is old. What we've done is we've come up with a solution that actually gives you a lung burden score. So we are now able to give you scientifically a lung burden score which says what percentage of your lung has been affected by COVID. And based on this lung burden, you can determine how to deploy your hospital's key resources, your IR, etc. So here in Apollo, which is using a COVID center, you could see we have annotated on the left COVID pneumonia, which is basically a dominant feature of COVID-19, including pulmonary consolidation. And we also give at the bottom a lung burden, in this case, 70%. So this way, hospitals can then work out a care plan which is more scientific, thereby improving the ability to use their critical resources, especially with India now, I think, at the third or fourth country in terms of volume. I've always felt that high tech needs high touch. So it's important to work closely with our hospital partners, closely with our teleradiology companies, in order to provide better user experience and adoption of this technology. We have done everything we could to de-risk it. So, the ability to do a no risk, no cost business model so people can actually test the algorithms based on their data. And those are some of the algorithms and solutions that are currently available from brain to bone to lungs to heart to mammo, etc. And we aim to become a company that is all in one to giving the maximum number of regulated products and be kind of the one-shop manufacturing center for as many disease conditions between X-rays, CTs, mammos, and other modalities in the future. I'll stop here because I think I'm getting closer to the almost 10 minutes now. So thank you and happy to take questions.
Okay, thank you very much. Well done. My question to you, first of all, I think we have a lot to talk about and take that offline. But my question to you, there's other competitors out there on the market. What is the forte? What's the advantage of Zebra?
Yeah, so there is competition, but you see what's happening today is, a few engineers get together, there is access to some level of data, and out pops an algorithm. I think what we figured out is algorithm is not the solution. And the access to over 500 million images, having all of them FDA regulated, most of them, and the ability to work closely with radiologists so that they adopt it. I think a combination of all of this makes the difference, because end of the day, it is in the adoption. Because unless a clinician is convinced about how this black box works and how it will help them improve clinical outcomes from a clinical perspective, and for the administrator, improve the financial outcomes, either reducing cost, improve patient engagement, or revenue. So I think we've kind of figured out this spectrum and are focusing on a roadmap which will create the maximum number of solutions for those modalities.
Okay, thank you. And the second question I have for you is, Zebra has done a good job in coming into India. What would you say is the pointers for other companies to be able to do collaborations with India for Israeli companies?
Firstly, Israeli companies should be more patient because I think I've always seen Israeli companies not being very patient. They need to be a little patient, number one. Number two, they should put India, I think, and at the same, I would say, compress, because typically they come to India 3 or 4 years after they've been in the US. And sometimes I've seen Israeli companies losing a lot of money and getting killed just getting a US FDA. And sometimes it makes sense to come to markets like India, where it's every fifth or sixth person is an Indian. The third thing I think is price sensitivity and understanding price performance ratio. And I think Indian clinicians are very, very smart. So you'll have to kind of balance the fee-for-service hospitals and the government hospitals. So the value propositions for a fee-for-service is very different from the ones in the public sector. But I can take those questions offline and share my experience.
Okay, spot on. That was great. Let me see one or two more questions. They want the contact of the sales manager. We'll get
Just
that
send me
along.
an email. Yeah. So I take care of pretty much all markets outside the United States. So yeah, my email is available. I'll just text it again. And we're already integrated with MedSynaptic in India. So MedSynaptic in Hyderabad, Chennai, of Apollo. So we're already there. Yes, we are 510K approved. All of them are 510K. Yeah, I think that answers some of the other questions which I saw on the Q&A. If there's any more, I'll send out some answers in my email. So feel free to text me anytime.
Okay, thank you very much. And thank you everybody for holding on.